Yeah, I hope my screen is presentation is visible and I'm audible.
Yes, both are clear.
Yes.
You can go
Yeah,
ahead.
thank you, sir. So I would be touching upon an important topic that in today's world of digital India, where everything is digital, digital payment and digital tolls in the highways and everything we are going digital.
Mangalore,
So
Mangalore garage, ಇಲ್ಲಿ garage.
one essential component of a smart clinic would definitely be digitalizing your clinic and making it a digital clinic and maintaining electronic medical records as much as possible in both outpatient and if you have a nursing home in inpatient as well. So I would be touching upon as to what are the problems we are facing without digitalizing our clinic as of now and how do we go about digitalizing our clinics. So what are the common problems we face in a day-to-day practice with regards to maintenance of the records? So the first thing is the legibility of the prescription. There have been enough memes and jokes made about the handwriting and the prescription. Even there have been articles published in the British Medical Journal about the legibility of the prescription and the medication errors that occurs because of the illegibility of the doctor's prescriptions. And a lot of medication errors, especially because of the illegibility of the handwriting of the doctors, which the pharmacists might not understand, and also sometimes similar sounding medicines might be similar spelling medicines might be actually wrongly prescribed or might be wrongly given to the patient, causing serious adverse effects. So it has been said that doctors themselves find it difficult to read their own handwriting, and the doctor's handwriting is no better at home than in the hospital. So why is it that most of the doctors have not a very good handwriting? So there's been a good review article on that, which actually says that it could be because we are in a hurry to write the prescription to dispose the busy OP and minimize the waiting time, and we try to establish eye contact with the patient when we prescribe the medicines, and over a period of time it becomes a habit. And then we also think that if we write legibly, then maybe we are not considered a busy practitioner. So a young practitioner might wantedly start writing it as an illegible handwriting so that we get a tag of a busy practitioner. And another problem after the illegible handwriting is the long waiting hours. So with the COVID scenario, most of the patients want to just walk in and then meet the doctor immediately. And this is not only the doctor's office, everywhere. We have zero waiting hour with web check-in, with Swiggy, with Book My Show, and everywhere. Even before the COVID era, patients do value their time, and we should also value their time, and we should try to minimize their waiting hours as much as possible. And another problem with the receptionist is too many phone calls. You have two phones and one mobile phone. All phones keep ringing, and the receptionist has to keep on attending the phone calls. In one phone call, there'll be questions about the appointments, about doctor's availability, and then about the doubt for the medicines, doubt for the vaccines. So this again is another big Herculean task for the receptionist. And another thing that we commonly see is the clinic wall is full of posters. So I think Dr. Sunil, when he designed this, he said that the clinic should look as neat as possible, and there should be no unnecessary posters. There could be the entire wall could be filled up with posters displaying about what are the rules for appointment, what are the regulations to be done, and all those things. But it actually might not, when there are too many posters on a wall, the message does not go to the patient as well. Other common case scenarios that we see when our clinics are not digitalized is the previous records are always not there. The patient comes to us with a single prescription or just the prescription paper in hand. We give them a file to file it. Sometimes they lose the file, the prescriptions are torn off from the file, and finally we might not get to know what medicines or what illness the child had previously. The past history basically is missing. And the vaccination status and the vaccine reminders are usually not done, and there are a lot of vaccines which are missed because the patients do not get timely reminders. And when it comes to the administration point of view, there are a lot of salary hassles in our clinic when we don't maintain a proper digital records for the salary. And the appointment system, as I told, is totally chaotic, and so is the account system without a digitalization. And there might be a patient with a previous history of allergy to a drug or a vaccine, which might not be properly documented in a physical record, and we might end up using the same drug or the vaccine again and causing rise to problems. And communication is again a very big task, or a very difficult thing to do when you don't have a digital record or the demographic details of your patients in a digital format. If you suddenly have to leave your clinic for 1 week, we are not available. How do you communicate? Right now we're just communicating through the phone. A patient who calls in, you tell them you're not available. But there are definitely easier ways to do all these things. So the solution for all these is the electronic medical records, and it's quite simple. So over the next few minutes, I would be covering the following headings. So the first thing would be the outpatient management. So in the outpatient management, with the digital records, the record keeping becomes very easy. That is basically your receptionist just enters in the demographic details. The patient gets a ID number for the child. You can also take the photograph of the child. And once the demographic details are filled and the patient is given an appointment time, the doctor's module, when you open it, the patient comes in the appointment time, you get the list. The live queue comes as per the appointment schedule. And once the vitals are entered, that is the height, weight, blood pressure, saturation, everything, all this is done by the front office. And once they do all that, you just go directly to your screen, where you start with the patient's complaints, then go to the examination, diagnosis, and any investigations if required, and treatment. So it's all just a click of a button. You can also use iPads or your tablets, where it's just a touch screen, or with a mouse or your touchpad. It's not as difficult as we think. And another problem that most of us think or might be a hindrance with the digital clinic is, especially with the during prescribing or during writing the medicines, we think that it's difficult to establish eye contact and then keep looking at the screen at the same time. But believe me, it's actually very easy, because like as the patient keeps talking, you just keep entering, and you don't need to type everything. Only typing might take time. Here you have pop-ups for everything. You start typing cough C, you already get a template saying cough. And the chief complaints can already be entered by your front office also. So you just have to click on the diagnosis, and there are templates for each and every disease. Suppose you have a patient with upper respiratory tract infection. These are the medicines you standardly give. You can actually click on the template. You can create 1 or 2 or even 3 templates, and the drugs, investigations, prescription medicines, everything would follow, and you can edit it as necessary. So the main thing advantage with the OPD management would be easy retrieval of the records. So you see a patient today, they come 1 week later, but they do not have the prescription in hand. Immediately you just type their OP number, you get everything on your system, and it doesn't occupy space. It's all cloud stored. Suppose the same patient goes to another place, to some other city, some other state, some other country, the patient also gets the SMS link, and they can view their prescription anywhere, anytime. So it will be easy for them to tell the other doctor in the other city or other state or even the other country as to what medicines the child had received previously. And the legibility, there's no question about it. It's going to be in a printed format, and it also is available in any language that you want, most of the regional languages and English. And you can share the prescriptions and the growth charts. That also is very, very useful. You have a very beautiful growth chart in all the online and the digital software that are available today, including the height, weight, BMI, weight for height, your mid-parental height. For everything, there are beautiful growth charts, and it becomes really helpful to explain to the parents live as to how the child is growing. Vaccination record, again, report of given vaccines, report of vaccines to be given with vaccine reminders. It's actually very, very useful. And as I was telling, you can create templates for certain complaints. Fever, Suppose you put the diagnosis as viral fever, you can give your regular prescription as paracetamol and list of investigations like blood count, CRP, urine routine. And this also serves as a checklist so that you don't forget or you don't miss any investigation or any medicines. So, and the prescription also comes in the local language as to what times of medicine should be given, what dose, and for how many days. You can also write how many how many bottles of the syrup or how many strips of the tablet that the child should be getting to complete the course. Apart from the outpatient management, the administrative aspects, appointment systems becomes really very easy, and a lot of time patients have problems as to I came first, you came first, and the Sanda Tagarar is always happening in the front office, and they think that they always have a feeling that they're not called according to their walk-in time. When you don't have a proper appointment system, when you say that you're available from 5 to 8, or you just come and walk in and then book your token, or after that you go, they think there are a lot of other patients who budge into their slot. Doctor தெரிஞ்ச patient or then an emergency, something or the other, they actually feel very bad about it. Maybe they might not tell us directly, but definitely the appointment system without a digital setup would be really difficult. When in a digital setup, it becomes really transparent. Patient books an appointment, they can do it either directly through the internet, or when they call your front office, the front office staff can book it for you. So if they book an appointment at 10:30 in the morning, the patient gets an appointment link with the time saying it's 10:30, and even the token can be delivered online itself. So the patient walks in at 10:30, he knows he's next or he's the first. So, and you can also have your TV or your screen displaying the list of patients. So it's absolutely transparent. A little bit of delay is understandable, but patients need to be reassured that they are being let in as per the appointment system, and there's no adjustments being made there. Emergencies are always understandable, that patients would definitely understand, but it is the thought that they are being pushed down the list which upsets them. And you can block holidays. Suppose say on Jan 14th or December 25th, December 31st, you're not available. You can block your calendar prior itself so that nobody can book an appointment on that day. You can also call up the patient if there is some change in the OP timings. Suppose you have 30 appointments waiting today, you're held up in a resuscitation, or you can't come for the next 30 minutes or 1 hour. You just click one button saying send late notification by 30 minutes to all appointments. You immediately get a message saying your appointment is delayed by 30 minutes. It is as simple as that. You need not ask your receptionist to keep calling every patient. Just one click, send late message, send late by 30 minutes or 45 minutes. All your patients would know it. And communication, as I told, becomes very easy, and you would be able to analyze the data in a better way as to your patient volume in every month, and which location. Once you enter the proper demographic details, you can understand which geographical location most of your patients come from, and you can probably conduct a camp or do any promotional activities for that if needed to help plan development of your clinic. Another important administrative aspect is the intranet, that is through a LA and through a local connection. Your system can be connected to the front office, and the communication with the front office becomes much more easier. Financial aspects also. If you need a 3C form, when your auditor asks, you can just generate it with a click. Accounting becomes more transparent. Receipt generation, many patients ask for a receipt. You can generate a receipt within a second, and you can manage multiple doctors' account if you have a polyclinic. And what about human resource? So this again, for attendance, you need not maintain any physical records. Your staffs can maintain an attendance device with the which comes with the software, and surveillance becomes very important. And we tend to think that it becomes more difficult for the staffs, or the front office staff would resist it. Initially, maybe they would, but once they start using it, they would actually be proud to use it, and they would definitely start using it, believe me. And you can also audit yourself as to how many antibiotics you've given, how many viral fevers you've treated, how many cases you've sent for admissions. All that can be seen. Another important thing is the last point on this slide. Prescription mentions the diagnosis. It is mandatory for you to enter a diagnosis. So like in our rational antibiotic practice, like Dr. Palniraman always says, you always think before you ink. So when you put the diagnosis as viral fever, you think once or twice or 1,000 times before you write an antibiotic. If you just write fever, you might tend to prescribe an antibiotic. But when the system demands you to give a diagnosis as viral fever, you might stop with just paracetamol. So it makes your prescription more rational. And the plastering is not required. Simple, very clean electronic displays can be with scroll boards can be put up as to the appointment system rules. And even for any, apart from the commercial displays, even for any health education, you can use these displays. So for health education also, when the patients are in the waiting hall, you can keep them busy with videos on these devices, on asthma, on obesity, on whatever you want. And very important is the CCTV camera. So this is very, very important. We have seen so many videos of misbehavior of patients. This becomes an important proof legally also. And also you can keep a silent watch on your front office. And relationship with the patients and fellow practitioners. Yeah, you might get referrals. You have a column for the referral doctor where you can enter the referral doctor's number, email ID, and you can send a reply to them online itself. Vaccine reminders are very useful. So the myths of this digitalization, we think that it is difficult to learn, but it is actually a very user-friendly software. We think it's costly, but it's actually definitely not costly. We, as I told, we tend to think we lose an eye contact, but we need not look into the computer at all. You just need to type like this and look into the patient and talk. So you will definitely not lose your eye contact. We tend to think the staffs will resist, but if you train them and you give them the confidence, they would be proud and they would not resist. Do you think it's time consuming? No, believe me, it saves a lot of time. And if you think your practice is already established, should you be changing it now? We have to adapt to the technology. So we cannot be without WhatsApp now. So similarly, without digital clinic setup, I think it would be difficult. We have to upgrade and update ourselves. So I would just show glimpses or screenshots of the IAP software. There are various softwares, DocOn, Practo. I have used Practo. I am presently using DocOn. They're both good, but IAP Axon software is also very good. And our IAP recommends the usage of this software. So this is the appointment list where your front office enters the appointments. You get a list as to whether it is a new patient or old patient and whether it's a referred patient and how much fees the patient has paid. Once the vitals are entered by the front office, you get to enter the clinical data, the chief complaints, the diagnosis, and then the prescription, the medicines. So the past visits, once you click the date in the descending orders, once you click the date, you'll get the clinical findings, the diagnosis, and the medicine that has been prescribed for that particular child on that particular date. So this is how the prescription would look before you take a printout, and you can keep it in your local language, regional language, whatever you want. And the vaccine schedule again becomes very easy as to what date the vaccine should have been given, what date it is given, and at what place it was given. Accounts, you just need to go to the accounts tab and click on what column you want, whether the receipt summary or the 3C case register, and within a click, it's done. Similarly, for the reports, as to what by diagnosis, you can get the reports, by medicines, or by symptoms. Suppose you say fever, you'll get the list of all the patients with who presented with fever in the last 1 month. And when you go to the others tab, you get the educational photograph or videos and growth statistics that you would have already saved or which is already there with the IAP software. And the certificates, when you have you can either give a referral letter like this with a template or with your fitness certificate, leave letters, everything. There's a custom, you can customize it as per your need and you just need to click on it. I'm done on just the last slide. And you can also put the instructions on the prescription so that becomes more easier for the patient to understand. You can manage your drug list and your inventory. The intranet message is where the front office communicates to you saying, this patient is waiting, this patient has this and this problem, there's an emergency. They need not come in and tell you every time. They can just type it at their front office desk and you will get a pop-up immediately. 3C case register, if your auditor asks, you can give it immediately. Diagnosis list, you can edit as per your need. Barcodes can be created if you really want to. Vaccine stocks are very useful. Once you enter the stock, as you keep prescribing the vaccine, you'll get a pop-up as to how many vaccines are remaining. So there might be situations where the patient has already entered your room, has paid the fees also, and when you're about to administer the vaccine, you realize the vaccine is out of stock. So here you might avoid all these situations, and all these analysis can be done. You can also do small researches and surveys based on these data. Yeah, vaccine reminders, SMS, your birthday reminders, everything. Once you enter the date of birth, every year from your name or your clinic's name, the child would get a birthday reminder wish every year. So, and any announcement that you want to make would also go to all the patients in your database. CCTV camera is a very important thing. And another important thing that I wanted to mention after the CCTV camera is your digital payments, Paytm, or make sure that you have some access to digital payments also. To summarize, digitalization of a clinics and electronic medical records with availability to electronic payments is the need of the hour. It is not the cost, it is the attitude that matters. And it is very user-friendly, it is not difficult to use. Also have a feedback or a suggestion form either on your online platform that you use, or have a suggestion box in your clinic to know what the patients really feel. Thank you.
Thank you, Dr. Karthik and Annamalai. It was a very elegant and comprehensive presentation. I hope with this, many of the young guns will go for digitalization of the clinic. I had been using a software